Hi there. So we're continuing on with Skin Rejuvenation Week, facial rejuvenation, whichever you want to refer to it as. And we have very excitingly got to the dermis. So the dermal layer is where all the action is. It's where your hair follicles grow from. It's where your sebaceous glands produce oil from. It's where all your tiny capillaries are, your nerve endings, etc., etc. It's also where your collagen sits. So your collagen is your main protein in your skin. It's a very fibrous protein, and it makes up 75% of that protein. Okay, so when we are born, we have plenty of it, and it's very well organized. And but unfortunately, as we age, we lose 1% of that every probably year of our adult life. And once we reach the menopause, we lose 30% of what's left over those sort of menopausal years. So it's really important for sort of maintaining your scaffolding of your skin, if you like. It supports the skin and it prevents those fine lines and wrinkles from showing, okay? So everything we do in clinic is around stimulating the collagen renewal and repair. So what we do is trick the skin into believing it's had a trauma, okay? And there's a couple of ways of doing that. It's using either heat, so thermal trauma, or tiny little wounds, which sounds more drastic than it is, not to be afraid of. So microneedling, you've heard us talking about microneedling. We've all said how much we really love it and we really rate it, okay? And here at Callista we use a microneedling pen. So this is an automated device. It has a little sterile bunch of needles. I'm not going to open because it'll be a waste. But these are set to go in and out very, very quickly. And we hold them over your skin and they go in and out. They just cause a very small puncture. Now that can be set to any depth, and the depth is dependent on your skin problem. So if you have hyperpigmentation, it's a very shallow depth. If you have deep lines and wrinkles, we'll go a little bit deeper. If you have acne scarring, we would also aim to go a little bit deeper. And as registered nurses, we are allowed to do that. Some of the beauty therapists aren't allowed to go, I think, beyond 1 mil. We would also choose what we call a power solution from our Genesis selection here. So that will be dependent on your skin issue. So it's twofold. You have the injury in inverted commas, or the controlled injury, if you like, that's going in to the skin. Fibroblasts are sent to heal that trauma. And one of the first things they do is lay collagen down in that process, okay? And the feedback mechanism is such that if you're laying down new collagen, the body will also lay down new elastin, which gives your skin rebound, and hydration will flood to the area as well. So the other thing is, of course, the power solutions get every opportunity to get to where they've got to go, which is into the dermis. All right, so that leaves these tiny little channels open on your skin for probably 8 hours. We do allow a little bit more. So there is that amount of time where you do have to be a little bit careful with hygiene, clean pillowcase, try not to touch your face, don't go swimming in chlorine for a few days. Obviously protect your skin from the sun, avoid any sort of heat related activity. So try and plan it so that you've got a couple of days where you are kinder to your skin. You may need to moisturize it a little bit more. We always give you a post repair cream to take away with you. But 2 days down the line you will be glowing and your skin will be plumped up, your dermis will be sort of a little bit thicker, and that just sort of fills out those fine lines and wrinkles. So for every 4 to 6 weeks, little microneedling treatment is a really good boost for your skin. And what I personally do is one of these every couple of months, and one of these. Probably every sort of 4 to 6 weeks, I'll treat myself to one or other of these. And they're just a really good combination going forward for skin rejuvenation and sort of long-term management of that.